Welcome to 6ABC's Weekend Extra, paid for by Mainline Health. Here's Jessica Boynton.
As hospitals and healthcare providers continue to reopen, doctors are encouraging patients to schedule their routine care and preventative screening appointments. For women, mammograms are one of the most important of those screenings. Today on 6ABC's Weekend Extra, we welcome Dr. Carruthers, a breast cancer surgeon at Mainline Health. We're going to discuss the importance of mammograms, the risk of delaying new care, and how to schedule an appointment during a pandemic. Dr. Carruthers, thank you so much for being here with us today.
Thank you for having me.
How often should women actually be getting mammograms?
So for my patients, I recommend starting a yearly mammogram starting at the age of 40. So once a year, we should be going in and getting the mammogram done. You can get a prescription for that from your OBGYN or from your primary care doctor. So for an average risk woman, age 40 is fine to start. For women who have higher risk of breast cancer, maybe they have a family history of breast cancer, or they might have a genetic reason that they're at increased risk of breast cancer. For those women, they may want to consider starting their mammogram at age 35, but once a year is perfect.
It's safe to schedule a mammogram during a pandemic. That's a big one right now.
Absolutely. So what we found is here at Mainline Health, we are using enhanced cleaning and safety protocols to make sure that we're keeping our patients safe. So you can expect when you come in to get your mammogram, you'll have your temperature checked, you'll be asked certain screening questions to make sure you don't have any symptoms of the coronavirus. And also just know that the staff has also been screened and they're also being checked. So we're making sure that everyone is safe. In addition, we have enhanced cleaning protocols in place, and all the equipment is being cleaned, all the touch points are being cleaned, and we're making sure that everyone is safe. So absolutely, come in and get your mammogram done.
Now, we know mammograms are important. Everyone tells us this, but why? Why are they so important?
Well, what we know is that having regular yearly screening mammograms has been shown to reduce the risk of a woman dying of breast cancer. So unfortunately, mammograms don't prevent us from getting breast cancer. That would be fantastic if they did, but they do help prevent breast cancer related death. So if you're getting a mammogram once a year, we can find a cancer when it's developing at a much smaller size than if you just say are doing your own self-exams and feel alone. And what we know is that for most breast cancers, if we find them at a smaller size, they're at a much more treatable, much curable stage, and they're less likely to maybe need treatment with modalities such as chemotherapy. In addition, if we find cancers earlier, we may be able to do more like saving the breast rather than having to remove the breast.
So what risks come with delaying or postponing a mammogram for far too long?
Well, unfortunately, the longer you delay the mammogram, if you have cancer, the more likely it is to be found at a much later stage. So later stage means either bigger, or it's spread to the lymph nodes, or maybe it's spread elsewhere outside of the breast and outside of the lymph nodes. So the more advanced the stages of the cancer, the harder it is to treat, the more likely you are to need treatment like chemotherapy or potentially removal of the breast. And unfortunately, the more likely you are to potentially die of the breast cancer. So delaying a mammogram is not a good idea.
How is Mainline Health equipped to help women with breast cancer?
So Mainline Health has 4 accredited breast centers. So our breast centers are accredited through an organization called NAPBC. We offer the breast surgeons, we offer radiation oncologists, radiologists, nurse navigators who help our patients through the whole process between an abnormal mammogram and having surgery, and then other people in the system who are just dedicated to taking care of our breast cancer patients.
6ABC and Mainline Health are proud partners of Well Ahead Philly. Visit wellaheadphilly.com for more resources to help you manage your health and live well. Stay safe. Make sure you make an appointment, and thanks so much for watching.
Well Ahead Philly helps you gain access to the information you need to feel better and live well every day. Thanks for watching 6ABC's Weekend Extra, paid for by Mainline Health.